Hi everyone, this is Dr. Pham at Arbo Dental Care. I'm so excited to be sitting here today, having a chat and trying to answer some questions about wisdom teeth. With wisdom teeth, the challenge with them is that we never know when they're going to be coming in. They're actually called wisdom teeth because they usually come in around 18, early 20s. That's usually when we were supposed to be wiser. That's why they're called wisdom teeth. When wisdom teeth come in, most of the time nowadays, there is not enough room for them to come all the way in, so they end up being impacted. And you might have heard that term before. When wisdom teeth are impacted and they don't have enough room to come in, they can either partially come in, but they will never come in fully. The other thing that can happen is that when they're fully impacted and they're below the gum, they might not be an issue right now, and they may never be an issue. But there's always that chance that if they become an issue and they need to be removed, usually that'd be around 40, 50, or even in your 60s. The challenge is that the recovery is much harder. You might need time off from work, and it's a more difficult surgery. That means it might take longer and the healing might not be as good. That's the main concern. It's up to you to decide when is the right time to do it for you. My best thing that I can do for you is to direct you which way is the best way to go. And you can make that decision when you're ready. With wisdom teeth, we normally recommend removing them before the age of 25 because after a certain age, they become more challenging and the recovery becomes more problematic. Wisdom teeth can cause several issues when they're impacted. They can either start trapping food and cause cavities, they could even cause damage to the neighboring teeth, they can change the bite, or they can lead to pain or infection. Those are the main reasons why we recommend removing wisdom teeth. When wisdom teeth are removed before the age of 25, they are much easier to come out. The healing time is less than a week, and usually you have some time off from work or from school, and that makes it a lot easier for you as well. If you do decide to keep the wisdom teeth, that is okay too, and what we would do is that we would monitor it every 3 to 5 years with an x-ray just to see if there's any changes. We would be looking for whether or not there's a cavity forming, whether a cyst is forming, or if there's other changes that is affecting the tooth in front of it. We want to make sure that it doesn't cause any issues, and if you can keep them, that'd be great. We can avoid a surgery. If they start to change and cause issues, then it would be a lot better for us to have that discussion again on whether or not it would be good to remove them. And we can always guide you through the process. Hopefully this answers some questions about wisdom teeth and how we can help. Let us know if you ever want to have another consultation specifically just for you. That way we can decide together on what would be the best options for you. Looking forward to seeing you soon. Thank you.